about pulses. Now we're gonna talk about blood pressure. So yeah, do you have any questions on chapters 9 and 10 up to this point?
Question from the, I mean, from the back of the vision.
You have questions about the back of the page? Okay. Alright guys, so again, real quick, let's go through these prefixes. Tachy. Fast, right? Increase. If I say tachycardia, it means increased heart rate or rapid heart rate. Okay. Brady means slow. I always think of Tom Brady because he's a slow quarterback. He's the best of all time, but he's slow. So I always think of Tom Brady when I think of Tachy versus Brady. All right? Or slower than normal. Slower than normal. But all that to say, know your prefixes. Tachy and Brady can be used in other forms. All right? So let's talk about blood pressure, guys. Blood pressure. Blood pressure is the measurement of the pressure of blood in an artery as it is forced against the arterial walls. Okay? Often blood pressure is obtained before an invasive procedure like surgery. You know, you always get your blood pressure. Sometimes, you know, you guys may be feeling a little dizzy. You may go to Walgreens, put your arm in the blood pressure cuff and check your blood pressure right there. Okay? The units, really important. The units of measuring blood pressure are millimeters of mercury, or this is the what is that called? Scientific. What is that called? What's our table called? Periodic table. That's the abbreviation for the element mercury.
Pascal. Pascal.
No, the periodic table. Periodic table. Hg, capital H, lowercase g. That's the abbreviation for mercury. Okay? So know that millimeters of mercury is how you measure blood pressure. It's bolded, guys, for a reason. For a reason. Okay? Now, when we're talking about blood pressure, we know when they do blood pressure, they do them on a graph, or we call it a spectral analysis, right? We call it a spectral analysis. That's what this is called, a spectrum. A spectrum. Okay? So, systole is the highest amount of pressure reached during contraction of the left ventricle. Okay? And diastole is the lowest point. It drops during relaxation of the left ventricle. So right here, during heart contraction, that's going to, out of the left ventricle, that's going to be systolic pressure right there. The pressure of the blood coming out of the left ventricle to the rest of the body. Okay? When the heart is relaxed and the blood is filling the ventricle back up from the left atrium, then it's going to fill it up, and that's when the heart muscles relax. Okay? So how that looks on our spectral analysis is that you see our little graph right here, right, guys? So the upslope right here, that's our systolic pressure right there. The peak right here, that's our, when we're measuring ultrasound, we call that our peak systolic pressure, or peak systolic velocity, because we're measuring velocity because we're doing blood flow. Okay? So that's going to be your systolic pressure, and then it's going to be your diastolic pressure, which again, the lowest point. All right. So when we think about systole and diastole, you see right here, even though you see it's still going down some right here, that's still considered systole. It's still doing contraction. All right. This little notch right here, that's called the dichrotic notch, and that's where it's going to switch from contraction to relaxation right there. Okay. And that little switch is why you get that little hump on your spectrum. Okay. That's called the dichrotic notch. All right? And that's where the diastole starts. You see the pressure relaxing and starting to come down. It's starting to come down. Guys, you see how this wave, starts on this side, it goes up and comes down before it comes back up? Remember we talked about that. What's that called? What's that called?
Contraction?
It's called being triphasic flow. Triphasic flow because it goes above the baseline. It starts below the baseline, goes above it, comes back down. Okay? The 3 phases is below, up, and down. That's why it's called triphasic flow. Right? So if blood flow, y'all already doing some stuff in here. If blood flow, this is my graph right here. That's another one. So if blood flow is like this, what's that, guys?
One phase.
Monophasic. And if it was like this, That's biphasic flow. Right? It's not in the book, guys. I'm just educating you. You know, that's biphasic flow. So because this goes above, before it starts a new cycle, it goes up, down, and up again. That's triphasic flow right there, because it's gonna have a little hump right here, boom, and then a new one to start. Triphasic flow. It's up, it's below, then it goes back above the baseline before a new phase starts. So this little area right here, that's the relax. It's relaxed completely. That's the area between one phase, and this is triphasic. Same thing right here. It just starts on the opposite side of the graph or the line. Okay?
So this is a triphasic, yeah.
Triphasic flow. Triphasic flow. So we'll get more into these right here, but I just wanted you guys to know the different types of flow. Monophasic, just above the baseline. Mind you, when we're talking about phases, we're only talking about arterial flow. Okay? We're only talking about arterial flow. All right? Because usually all veins are usually monophasic, right? They're usually on one side of the baseline or the other. Okay? So continue talking about blood pressure. The most accurate blood pressure is taken when the patient is sitting or lying down. Okay. The arm is used for obtaining the blood pressure must be at the level of the heart. Guys, the reason that your arm must be at the level of the heart because it's called hydrostatic pressure. The pressure of blood or the weight of blood is different depending on the relationship it is to the heart. So if it's on heart level, that means that you don't have any hydrostatic pressure. I'll explain that to you guys in the future when we're in gym. We're talking about hydrostatic pressure because the pressure above the head, above the heart is negative pressure. The pressure below the heart is positive pressure because of gravity. It makes the weight of the blood heavier. That's why it's important to measure the blood pressure at the level of the heart, okay? Because of hydrostatic pressure and the weight of the blood. All right? Like our guy right here. So if I shouldn't raise my hand even if I did it like this. I'm not on the level of the heart anymore. Your arm has to be down for that. Okay? Because you want everything to be at the level of the heart. Or that's also why it's best to take it while the patient is lying down. Because the whole body has zero hydrostatic pressure because your whole body is on the level of the heart. It's on one level. In that case, I'm able to get a blood pressure in multiple locations that way. Okay. We do something in ultrasound. We do what's called ankle brachial indexes. Well, we'll actually use these cuffs right here to get different blood pressure at different locations. So we'll hook these cuffs up, hook them up to the arm, hook them up to the upper thigh, right above the knee, right below the knee, and the ankle. And we're doing that. We're going to fill those cuffs up with air. And then we're going to get the blood pressure when it comes back. Because that's all this is doing. All this machine doing is cutting off your blood flow, and then it's tracking the blood pressure when the flow decides to come back or when the pressure of the cuff is less. Okay? So you guys will be seeing that. That's called an ABI, an ankle brachial index. All right? The sonographer will typically use, guys, I've never been in an instance where I had to take blood pressure. Like I said, I usually have a nurse working wherever I'm at. So, but you may have to. The sonographer will typically use a stethoscope right here. A stethoscope, everybody knows what that is. And a sphygmomanometer. 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 I've been practicing. Yes, I have. Yes, I have. Before I came
4 syllables.
Huh?
4 syllables.
Sphygmomanometer. That's just the cuff, guys. That's just the cuff that they use when they remember when you go to the doctor, they listen to you, and then they put the cuff on you. They put the thing right there on your where your pulse is, so they're listening and pushing at the same time. That's what the nurses do right there. So those are the instruments used to take blood pressure right there.
So the maneuver this is the name of the maneuver or the machine then?
That's the name of this device right here. This device on the left.
Okay.
This device right here is called the stethoscope.
Stethoscope.
This device right here, that's the sphygmomanometer. Okay. Guys, a dramatic change in blood pressure can indicate severe and possibly life-threatening problems, not severe, but severe. That's my bad. All righty. So these are some factors affecting blood pressure, guys. A dramatic change in blood pressure can indicate severe and possibly life-threatening problems. So things that affect blood pressure could be your activity or lack thereof. You know, that definitely can affect your blood pressure. Your age, you know, your age can affect your blood pressure because when you're young, you tend to have a lower blood pressure. The older you get, your blood pressure tends to get higher. Okay. Body position can affect blood pressure. Gender, males tend to have a higher blood pressure than women. Okay. Medication, some medications can cause your blood pressure to go up. Some can cause it to go down. Postprandial, guys, know this term. That term, again, that's a registry term. You always gonna have to know about that. Postprandial means after eating. So a lot of times people will come to you and say, you know, man, or the doctor will put on their postprandial pain. You know, and a lot of times when you see that, that's an indication for doing a gallbladder exam. Because a lot of times when people eat, after they eat, they eat a fatty meal, that'll trigger the gallbladder to emit the bile, right? Because it helps break down the food. But that can cause pain in people as well. So that postprandial pain, a lot of times is associated with gallbladder disease or gallstones or gallbladder obstruction. Okay, but know that word postprandial means after eating. Preprandial means what, Farnaz? Bang, bang. It's not trick questions. It's not trick questions. Okay. Also, stress or pain can affect blood pressure as well.
So what the postprandial do with the blood pressure is increase?
It increases. It's going to increase after you. It's going to increase after you eat.
So
But that's why you shouldn't take it. You shouldn't take your blood pressure after you eat because it can be falsely elevated. It can be falsely elevated. Okay.
And why I didn't understand why it goes up.
It goes
After
up.
eat, yes.
Probably because your body's working harder to digest this food. Your body's working harder to digest that food.
Let's go to the stomach.
Okay. Also, this woman looks stressed out. She had a tough day at work. Stress or pain can affect the blood pressure as well. Okay.
Time of the day.
By and the time of the day, blood pressure tends to be low in the morning and higher in the evening time. Okay. So those are the different factors affecting blood pressure right there. That's on table, guys. 10-9, page 281.
What about exercise?
Exercise, it can definitely exercise can affect it, you know, but it can affect you different. If you're a physically fit person, you know, you tend to have a lower blood pressure, you know, but if you out doing vigorous work, your blood pressure is going to tend to go up. If you're out doing vigorous work, it's for the short amount of time, not for the rest of the day. But if you're out there working real hard, I don't know, doing your mountain climbing, doing some kind of HIIT training, you know, I'm sure your blood pressure will go up for a short amount of time. Okay, because your heart is going to pump too. All right, so those are factors affecting blood pressure. All right, and these are blood pressures by age, guys. I put this on here because I do want you guys to know this chart. I was looking at the test, so there you go right there. There you go right there. These are normal ranges, guys. Remember, millimeters of mercury is how we calculate blood pressures. Okay, this is in the book, guys. That's a chart, table 1010. Page 283. So notice how blood pressure is higher in adults than it is for adolescents or children. All right. You know my diastolic and systolic pressures right here. Systolic and diastolic right here. Guys, this right here is supposed to be normal. This is our normal. 120/80 is our normal. Apparently I'm making too many typos. Yeah, that's our normal right there. Right? This right here, it shouldn't be systolic. It should say normal. It should say normal.
That's what's it.
Quick fix. Bang. There we go. Now you can get your picture. Now you can get your picture because it's accurate. Alright. So those are blood pressures by age. Alright? So let's talk about hypertension, guys. Hypertension, of course, means having high blood pressure, right? Y'all, anybody know anybody with hypertension, high blood pressure?
Sometimes.
Sometimes? Sometimes it's a sin? Alright.
But I manage it with the food.
Okay.
Yeah.
Opposed to. Okay. So we got two types of hypertension. Hypertension is described in two ways, both being essential hypertension or secondary hypertension. essential hypertension has no known cause. If it has no known cause, that means it's idiopathic. Okay, that's what that term means. Idiopathic means no known cause. Okay, that's essential hypertension. Secondary hypertension has a known cause. It can be a disorder that gradually affects the patient. Sometimes that's why sometimes blood pressure is tough because, for example, I think I was telling Pat about this. My little brother, or my little cousin rather, he, you get nervous and stuff when you go to the doctor. So he would get really, really nervous when they were taking blood pressure. His blood pressure would be high every time they took it. The same way, because he was nervous, not because he truly had high blood pressure. He was taking blood pressure medicine, I think, a couple years before they realized that he really didn't have high blood pressure. So sometimes, dude was like 25. That's why I was going crazy. Like, bro, you don't have high blood pressure. You're an athlete. What you doing? But sometimes those nerves when you go to the doctor, like everybody's nervous. I'm nervous when I go to the doctor, even though, I feel like I'm good, but you never know what the doctor gonna say. So when they come with the blood pressure, they getting all serious. Ooh. I don't know. Young black guy though, blood pressure affects black people more than anybody. So I'm, probably not surprising to the doctor. Remember we were talking about salt. My people that we were talking about salt in lab the other day. All right. So it can be patients should have routine blood pressure analysis if there's a family history. Guys, this is my own opinion right here. This is me going off of the book right here. If there's a family history, I assume that blood pressure can be hereditary, but at the same time, I think it has everything to do with the diet. Familiar diets get passed down from now this generation right here. Now I feel like people are getting to have more education about food and health and what's good for you and what's bad for you. Growing up, I'm sure like my grandmother cooked what her grandmother made and my mom cooked what her grandmother made, and now this generation right here, we know how to eat healthier. We're not eating chitlins and pig feet and and using lard, the fried chicken, you know what I mean? So I think when I think about high blood pressure, I think more of a familiar thing, like familial diets, because you normally eat how you grew up eating, how your parents eat. You know what I mean? So, but for the purposes of this book, it's hereditary. It can be hereditary. But for me personally, just living this life, I think it has everything to do with how you eat. How you take
It depends on the activity.
Yeah.
that too.
How much
That too.
exercise you do.
You don't want to be dormant. You definitely want to move around and get if you need to do